Welcome to another episode of The Verdict, a podcast brought to you by MLMIC Insurance Company. I'm your host, Tammie Smeltz. Today we have a truly special episode lined up as I sit down with the experts from MLMIC's very own risk management department. Hi everyone and welcome. I am really excited about today's episode. Today we are honoring Healthcare Risk Management Week, which is celebrated annually in June. And what better way to celebrate than to get to know MLMIC's very own risk management team. Now, to get things started, we're going to meet each one of our risk management consultants, starting with Mark Ambrose. Mark, can you introduce yourself?
Yes, thank you, Tammie. I'm Mark Ambrose. I am a senior risk management consultant with MLMIC Insurance Company. I cover basically the 81 corridor, so from the Pennsylvania line to the river and Utica to Rochester. And I have been with the company for a little over 12 years now.
Thanks. Joyce, can you introduce yourself, please?
Certainly. Thanks, Tammie. Great to be here with everyone. I'm Joyce McCormack. I also am a senior risk management consultant with MLMIC. I am a registered nurse, and I've been with the company. I came a few months after Mark, about 11 and a half years, and geographically challenged, but I cover the state from almost up to the border, and I go down as far as just before the bridges in Orange County. It's a pleasure to be here.
Great, thanks, Joyce. And just so you know, I'm a little geographically challenged as well. So when Mark pulls out the North Country, the Pennsylvania border, I'm not really sure what that means, but I just nod my head and say, okay, I'm glad you are going to those areas because I don't know where they are really.
Me too. I was nodding as well.
Okay. Next we have Shelly. Shelly, can you introduce yourself?
Great. Thank you, Tammie, for having us. This is really fun, I hope. My name is Shelly Kriete. I am a risk management consultant, senior risk management consultant with MLMIC. I've been with the company for about 7.5 years. However, I was fortunate enough to be an insured for about, we're thinking 15 to 17 years prior than that. My coverage area is Western New York, which is on the other side of that 81 corridor, probably from Rochester and beyond, north and south.
And I'll just add that I'm not geographically challenged when it comes to Shelly because she and I are partners in crime and we often travel together through the Western New York area, and we're grateful to have her. And our next risk management consultant is Deanna. Deanna, you mind introducing yourself, please?
Thank you, Tammie. So good to be here with you today, as well as with everyone in the risk management department here. Basically, I cover the downstate area. I've been with MLMIC for 4 very quick years, kind of flew by. And I cover Nassau-Suffolk County in Long Island, Staten Island, Brooklyn, Manhattan, all the way up to White Plains. So really great to be here with everyone today.
Thanks, Deanna. And I think it's clear geographically that we really cover the entire state with our risk management services, which is really just awesome for our policyholders. Now, listeners, we're going to spend some time getting to know our risk management consultants, and we have an array of different questions that we'll be discussing. And the first question I am going to shoot over to Joyce. Joyce, what led you into the field of healthcare risk management?
Sure, Tammie. Thank you. I think that as a registered nurse, and all healthcare professionals, we are pretty much vested in risk management, in patient safety, in quality and healthcare delivery. So I think that that's kind of been in the DNA since the get-go. But as far as getting to risk management at MLMIC, I was actually told about this job by, I knew a guy who knew a guy. He actually had gotten a call asking if he knew someone who may be a good fit as a risk management consultant at the company. And he called me. I was not unhappy where I was, but I thought, okay, let me go interview, see what we have to hear back and forth. And then after I met with everyone, I went back in my car and it was like high school. I'm texting my friend, oh my God, I like them. Did they like me? And that really, I'm not making that up. That's really how it happened. And very happily, I got a call a couple of days later, and here we are making a podcast.
I love that story, Joyce. I had never heard that before, and I'm very happy that you got that call. Now, Shelly, what led you into the field of healthcare risk management?
Thanks. For me, I think it was more of an evolution than a choice or a path. Um, like Joyce, I started at the bedside, and following that, I was away from acute care for a few years. And then I decided to cross back over into the hospital healthcare system space. And my roles when I went back into acute care always covered patient safety, risk management, quality improvement, quality management, those sorts of things. Over those years, risk management itself seemed to evolve, as we're all very familiar now, from just the clinical aspect of things, more to the organizational wide enterprise risk management realm, which basically seemed to be what my passion had become, to work with folks across the organization and focus on patient safety. That really is what risk management is all about, including keeping the organization safe and productive as an entity. Then, about 7.5 years ago, I decided that I was going to leave acute care again. And with a team that I had with MLMIC, I let them know, as anybody would with a transition, that I would be leaving and keep them apprised of, who my replacement would be and that sort of thing. And after I left, not unlike Joyce, I knew a guy that knew a guy that worked at the company, and I got a telephone call in the evening and said, I need your resume by 9 o'clock in the morning. And I sort of laughed and said, I haven't seen my resume. And at that point in time, it was about 17 years. So anyway, I put pen to paper really quickly, put in my resume, had a very quick turnaround and an interview with folks from MLMIC, and I'm going to say that I'm the lucky one because I'd always wanted to work for MLMIC. So I ended up here. Now I call it my dream job. So when I decide that I'm not going to do this any longer, maybe I can write a romance novel.
All right. Well, I would love to read that romance novel, Shelly. That's funny. And interesting, we were just talking about connections this morning with some of the interns that started today, and it's all about who you know, right? And here it is, clean, clear as day that both you and Joyce got this job at MLMIC by people that you were connected with, who thought of you, who told you to apply, and good for us that you're both here. Now, Deanna, what led you into the field of healthcare risk management?
I too, first of all, Shelly, would like to read that novel. Maybe you can make it hospital based. We'll see. Looking forward to it. Anyway,
I think it would be really funny. It could be a doctor nurse, a doctor nurse novel, and with some risk management involvement. That would be.
who knows? Yeah, some
Yeah.
high stakes risk management. Anyway, I think for me, it was a bit of a full circle. I was working as a nurse, like all of us at one point, and working in a very high risk area, labor and delivery. A few of the docs at that time were doing legal reviews. So it did start to pique my interest. And, after reviewing records for so many years, doing those chart audits, plus a paralegal background, naturally led me to legal nurse consulting. And at first I did do it on the defense side of medical professional liability for a few years. I also spent a lot of time on the plaintiff's end of it over the years as well. And really then, I guess, a few months before COVID, ironically, I started to, look around a bit, at risk, at quality. I always wanted to, take a look into those areas. And then obviously, things got put off a bit during the pandemic. So I was doing a lot of home care again at that point because there was such a need. So super busy. But once things did open up again, I saw that MLMIC was hiring. I didn't know a guy who knew a guy like Joyce and Shelly, but I saw it posted and I applied for it. And after a very long interview with, at least 3 people, I was hired. And like I said, a very quick 4 years, here we are.
I know, Deanna, it seems like you've been here a really long time. We've worked so closely together. And you
It's
have
all
such a
good. Yeah, all good
great
stuff.
background too. I didn't realize that you did home healthcare nursing, which is just amazing, especially around the COVID time. So that must have been really challenging and rewarding.
It was both.
All right. And last but certainly not least, Mark, what brought you into the field of healthcare risk management?
Thank you, Tammie. I really kind of fell into this by accident too, much like my colleagues. I unexpectedly heard about an opening here at MLMIC through my significant other, an anesthesiologist that she worked with, has a family member that works here at MLMIC, and learned of the position through the two of them, and applied. And here I am, 12 and a half years later, still enjoying it. And the transition was very smooth, I think, just because of what Joyce talked about too, being a nurse and having so much overlap. So between my nursing career, the leadership roles that I had in my career, and all of those experiences kind of tied in, and there's, that significant overlap in risk management, and just made things smooth.
Great. Thanks, Mark. And Mark, I think we're going to stick with you for the next question. So how can you service a MLMIC insured physician, practice, facility? What are the services like? What do they entail?
That's a great question, Tammie, and they vary. They'll vary based off of the account and their needs. It could be something that they're looking for, as far as like policy reviews, or maybe they've got a question about risk management and something that's happening right then and there. But there's so many ways that we're able to help. If they have an established relationship with us, a lot of times we have frequent phone calls or emails back and forth. If they're not familiar with one of the four of us, it may come through our call system. As an example, I had a call this morning, and it was really kind of an emergent call for that practice. That ended up evolving into something a little bit more. I had to have one of our attorneys get involved in it, so our legal department. So we work closely with them as well, not just our insureds, but the other departments within the company. Other ways, and this is what makes the job interesting, I think, too, from a risk manager standpoint. There's so many different things that we do. It's not just the telephone calls and the emails, but I'll be out of the office a couple days this week doing surveys. Whether those are facility surveys or office-based surveys or biomed surveys, but there's an allotment of different types of surveys that we do. We provide all kinds of education, whether it's virtual or live and in person at a facility or an office practice. We do lots of education and partnerships with organizations like Haney's and MGMA. And then, we try to customize those educations as well. And we also develop CME activities. We've got our proactive risk management initiatives that we all work on. And then we also contribute to our publication with the scope. So every day here is different, and there's lots of different ways that we can help our insureds.
Wow, that's a lot of risk management services. Do you have a favorite service? Is there something that you really like to do? Not to put you on the spot, but just wondering.
Well, you did. You know what? I enjoy everything that we do, and I enjoy the variety of the work that comes through. And I guess most of all, what I'd like is the interaction with the insureds, and that can be through phone calls. I prefer to be on site helping them do different things, whether it's education or a survey or working through a process improvement and helping them with that. So I think that's the most enjoyable part for me of the job, are having those direct connections and interactions.
Yeah, that makes a lot of sense. And, for me, thinking about that survey, that is such a benefit for our policyholders. And it's a great way to learn more about your insured, your account, your group, and a great way to collaborate with them.
And Tammie,
It,
if I can
Yes.
add to that, just thinking about how we all came to MLMIC because we knew someone who knew someone. I think to echo what Mark said, working with our insureds, but being able to put them in contact with who they need to be with, whether it's an underwriting question or many times a legal question with the firm, and just helping coming to a solution. It's nice having, helping someone make the connection they need to get the resolution that we know is going to be best for everyone.
Agreed. It's like you guys are the triage for MLMIC Insurance Company, which you probably all were triage at one point in your nursing career, right?
A variation of, I would say.
Yeah.
Without a doubt, without a doubt.
Yeah. Okay, so Deanna, my next question is with you, and Mark touched on this a little bit. I know that you all interact with different departments throughout the organization. Can you tell us a little bit how you collaborate or work with departments such as claims, underwriting, marketing, and even legal?
Sure, sure. We do quite a bit of interacting between the departments, like both Mark and Joyce mentioned. Often, a team approach to servicing our insureds, which really works out great. As far as claims, it's identifying that activity that's been taking place, looking at recent trends, and really seeing where our risk management efforts can be focused. In assisting our insureds, and really underwriting. Our insureds may pose a question to their underwriter. For example, they are closing their practice, they might have to end their coverage, or sometimes they're looking to provide a new procedure or a new medication to their patients. They'll give a call in, they'll see if the policy would cover it, and then underwriting will want to know the risks of, say, that particular procedure or that new medicine. So we have to do some research regarding that. And then, to be able to appropriately address whether the policy, as it stands, would cover, the changes, with these new medications, new policies, whatever it may be. And then, that in turn, might lead us to having to consult with the legal department, like Joyce said, getting whatever needs to be done to service the insured. It might be that consent question that comes up. It might be, the insureds that are developing new policies for different things that they're doing within their practices. And they need someone from risk or legal to, put those second set of eyes on it. So we do work a lot with legal, especially with education, providing, presentations, webinars for insureds, for facilities, for, office practices, residency programs, nursing programs. And really all of those are just, other ways that we interact with the legal department and marketing as well. They are setting up a lot of these things for us. And I don't have to tell you, Tammie, we've worked, quite a bit together, over the years, and, just putting together these events for insureds. So all those kinds of things are the ways, in which that, we get involved with the different departments here at MLMIC.
Yeah, and Deanna, I can say from a marketing standpoint, I work with all four of you, right? Either, attending events with you, where we're always grateful for the four of you working our table for us at certain events, and certainly the photos that all of you send to us from events. So from a marketing standpoint, that's very helpful for us. And I'll just give a little shout out to Joyce that I've, changed the whole way I set up my table because the way she sets up her table at these marketing events, which I love her, where she puts the little post-its with the pen on a diagonal. So you guys are awesome from a marketing standpoint, all four of you.
Thank you.
Thank you.
I just love her table. So our next question is going to go to my friend Shelly. What does a day in the life of a MLMIC risk management consultant look like?
Well, interestingly enough, I'm following my two colleagues, Mark, Deanna, and Joyce's add-in and all of that. And I'm going to say now, there are no 2 days the same. And there are no 2 days the same for us as a collective group of consultants. So basically, I'm going to quickly describe it as you have a little soft pouch with a whole bunch of Scrabble pieces in there related to pieces of education, telephone calls, traveling to be out on survey and that sort of thing. So every day, unless you're scheduled to be out for a survey and you know that you're out of the office, when you're in the office, it might be somewhat of like a Scrabble game. You pick out 5 or 6 pieces and you start working on them. But then again, there could be a call. For instance, I'm going to use a live example. On Friday, the team, and most of us work in a team, as you heard, claims management, underwriting, marketing, risk management. We work as a team. So we were notified on Friday of an event that one of our organizations needed assistance in navigating. And that required 3 of us. So we consulted internally on Friday. The organization asked us to have a meeting. This was obviously unplanned on Friday, but a meeting for this morning that took up the bulk of the morning, let's say, and working through what the potential legal issues were, risk management. On my end, I was discussing with them many functions that had occurred in this event and trying to help them put it together in a picture. We are talking about, an event with a patient turned into a grievance. Now there's questions with potential claims based on language the patient is using. So again, that was today, and now we're, recording, and I will finish up, at the rest of the day. We could be out, like I mentioned, on survey. Mainly, our day is driven essentially by what the needs of our insureds are for that particular moment. We could get a telephone call or an email directly. We have established relationships with our small, medium, and large groups. From the geographical perspective, I have, many of my insureds that will reach out to me directly. So we could be researching to answer a question for one of our insureds, and that may take research from the legal end. So we're going to reach out to our colleagues there. Deanna had a really nice example. We may get an insured reach out to underwriting and say, I'm going to start add this new service line or add this new provider. Underwriting is going to say, yes, you're covered in all likelihood, but why don't you talk to risk management and see what other things you have to give consideration for? So I'd be looking at that particular service, giving thought to policies and procedures that may need to be tweaked or developed entirely, and other risk management things that you may have to think about putting together. So brainstorming, general support for our organization. I say a lot of times, sometimes risk management is just having an out loud discussion with somebody else about a particular event to decide what the best path is to go down. And as you heard in the beginning, with our collective and individual years of experience, we're able to provide our insureds with a broad spectrum view of what might be to them as, an isolated pinpoint issue that they're dealing with at hand, when actually it's a little bit broader than that. So we're able to give some objectivity from maybe 80,000 feet. So again, a day in the life could be a multitude of things. Sometimes, like it is at the bedside, your day may not have go as planned.
And I bet that's why your job is so interesting because every day is different and every day is unexpected, you know? And I love what you
It
said.
is.
I love that you said that your day depends on the needs of our insureds.
Yeah, that really is our focus. We have other obligations. We talked about the education we do. It takes research and development to put those programs together. Maybe we are, drafting a podcast for all of our insureds to see. And, I'm going to be honest with you. This sounds a little corny, but it's true. I generally love my job and what I do. I love being able to provide the support and the time and the resources that so many of our insureds don't have on a daily basis. And our organization has a collective breadth and depth of knowledge, which is really there for them at a phone call or an email.
Yep. And that's what separates us from our competitors. So
Yeah.
our next question is going to go to Joyce, and it's not going to be about her table. Joyce, what is one way you feel you can best assist MLMIC insureds with their risk management and patient safety concerns?
Great question, Tammie. And I think the one thing we haven't talked about is kind of our philosophical approach. And we are always about coming from a proactive standpoint. We want to have things in place. We want to mitigate the risk before the risks are happening, and certainly learn when things have happened so that we don't repeat them again. So for me, I love when I'm working with my insured, if they need help delivering a message. Perhaps they need some more support, they need some more rationale, some teeth into something that they're having trouble working through at their end, and being able to help them deliver that message and get it across the line. That's really very rewarding for me. And we talked about all the services that we offer, but for me, I'll just highlight when we do either facility, office-wide surveys, or if we're going to do a focus from a service line standpoint survey, for example, the emergency department, the operating room staff. There are two things that I will always do when I'm on site, and I will always end the survey with, okay, these are my two promises to you. The first is I'm going to send out a draft so that you are going to see and you can react to what we have found here. And there's usually no surprises because there's interaction going on throughout the walkthrough. But it's really important to me that my person who I'm working with at the facility or the practice is not going to be blindsided by anything that's going to be in the report. And then secondly, if there's something in the report that is not in the report, or if there is something that you would like me to say differently or add to it, of course, if it makes sense, then I'm happy to do that. Again, helping our insureds to really deliver the message that's going to keep everybody safe, that's going to improve quality of care, that's going to underline the proactive stance we have in the services that we provide for our insureds.
And Joyce, I'm glad you brought that up about delivering a message because I didn't even think of that. But I've seen it myself happen a number of times where accounts we're in an account meeting and the leadership will say, well, the healthcare providers won't listen to me, but they will listen to you, MLMIC, right? So that's
Yeah.
something that I see you guys often, assisting insureds with.
And that our legal department helps tremendously with that too. And again, sometimes it's the same thing, but if you just say it in a different tone or it comes from a different face, all of a sudden we can have that aha moment, and that's a great thing to see.
Exactly. Okay, we're going to go back to Shelly. Shelly, what is one risk management patient safety topic you are truly passionate about?
Truly passionate about. This is more on the clinical side. That's where it begins. However, we know now through years of experience, claims analytics, etc. Listen to your patients and their families. Um, there are statistics out there that show, happy patients are less likely to sue a medical provider. But outside of that, from the patient safety perspective, sometimes we let, and not with ill intent, but sometimes we let our own personal biases, our own personal limitations, or just generalized, clinical bias may create, some tunnel vision for the providers, but to listen to what our patients and our families are telling us. That always, provides us with the best space to provide quality of care. And then there's a part B to all of this, and that's related to patient complaints and grievances, which I have more years than I wish to count experience in dealing with patients and families' concerns, whether they're in writing, in person, a telephone call, but about some part of the care that was delivered that they are unhappy with. So many people say, well, the customer is always right. Well, that's based on the circumstance. But what I have found, even those people who seem to present themselves as somebody that would never be happy, no matter what you do for them, I really don't think there was ever a complaint, a concern, an unhappy person that I addressed that if I just paused and listened to what they were telling me, that I could walk away from that with some pearl where I would know as an organization, as a group of individuals, as an individual provider, maybe we missed the mark, and what can we do? Joyce mentioned this way early in our discussion. What can we do to do it better tomorrow? So if we just listen and reflect on how we operated through that, there might be some improvement initiatives that we can walk away with. And it actually is just showing our patients respect. When patients and their families are listened to, they feel as though they address that as part of good care. So if you address them and you listen to them, they may answer a question or think that is good, a part of good care, even though it's not clinical in nature per se, if that makes any sense.
That does make sense. And that's actually something to be mindful of in all aspects of life, right? Not just healthcare, just pausing and listening to the person that you're, connecting with.
Yeah. Listening to understand versus listening to respond, I think is a big piece of that overall.
Exactly. All right, Deanna, do you have a topic, a patient safety topic that you are truly passionate about?
Yeah, I know, Shelly talked a little bit about communication and, but I can very easily say documentation as well. And, or maybe a tie between communication and documentation, but really documentation. And I guess maybe it's decades of looking over records, and really seeing, how that event may have been avoided. With just a couple extra minutes of review or reading over what was being put into that record, and sometimes that could have prevented that event from really becoming that serious patient harm. And we always recommend, our insureds, if something has happened, if there has been an event or an incident, to let us know while everything's fresh in their memory. An event file, can get opened with our claims department, which is another way in which we interact with claims and really if no papers, no lawsuit has been started, within 6 months that file goes away. Premiums aren't affected. So really, it's just a good practice rather than trying to recall what happened a year, 2.5 years down the road. So I get really passionate about things like that, and having insureds being proactive when it comes to these things that are happening. We're here, we're a phone call away. Just give us a call, and this way we can direct you in the right place. So that and the communication, really big for me, I think.
Yeah, and documentation has been a liability concern since the beginning of time, right? And it's never going to go away, probably despite all of your wonderful efforts, right? So I bet you have to revisit that quite often with insureds.
Yes, we do.
All right, Mark, any topic that you're passionate about?
Yeah, I'm gonna kind of shift away here a little bit, and I'm gonna talk about behavioral health. Um, this has become a topic, I think, in the last 5 or 6 years that I have been involved in on a couple of different levels, and has become very passionate for me. Mental health holds equal significance to physical health, yet it seems to be overlooked. I think much because of the stigmas that can come along with mental health and mental health disorders. But it has significant impact on our day-to-day abilities to function. It also impacts that physical health as well. So, it can diminish the quality of our life. It can cause anxiety, it can cause depression, it can cause problems with interpersonal relationships. It can cause burnout. So it's not just that we're seeing this in the patients, but it's also about the mental health of ourselves, the care providers, so the doctors, the nurses, the APPs. And I think since COVID, there has been a significant increase in attention on these things, which is fantastic. But mental health and the services that are around, I think have changed drastically. So I graduated from nursing school in 1995, and when we did our last semester, it was our behavioral health portion of clinicals. And the behavioral health facility that the college had typically used had closed. So this was all part of closing facilities, treating people on the outside, having the resources available. And that trend has continued. Unfortunately, I don't think that our services on the outside have been able to keep up with the demand. And we're seeing more and more mental illness, and I think there's a lot of different reasons for that. We know there's a huge genetic component to that. So the more we reproduce, the more mental illness there's going to be. We've had, not to get too political, but there's been some bail reform. And I bring that up not about the bail reform, but I used to be a health administrator for a jail and a correctional center. We had a huge population of mental health. Well, if these people aren't in jail anymore getting services that are provided in jail, they're back out on the streets, and we've got to have those services available for them there as well. So it just creates such a really kind of a burden on society. We end up with homeless people. We end up with substance abuse. People get into the criminal justice system, and that becomes a revolving door for them. So we really need to get the mental health needs of the people met. We have to, and so from a risk management side of things with that, we've got to make sure that we know how to handle these individuals when they're being seen in the hospital, or when they're coming into our offices. And we also need to know how to take care of one another, so that we're not getting burnout ourselves. We're taking care of our own mental health. We're taking time for ourselves. And we're really promoting mental health and well-being across the board, so that things can be more effective and productive.
Thanks, Mark. That is such a huge societal concern, an issue, and I feel like we could have you back on the podcast to talk for hours on this topic. So we might have to invite you back to get some more insights because that was really impactful and thought-provoking.
Would love to come back.
Yeah, well, I think you're going to be coming back sooner than you might have anticipated. And Joyce, do you have a safety topic that you're passionate about?
I do. Certainly, everything in life, in healthcare as well, always starts with building relationships, and I'm very big on that. But from the risk management standpoint, I will always open and close with the trifecta, and that is what we call the risk management trifecta. Shelly and Deanna mentioned documentation, communication, and follow-up. And sometimes I will joke. I'll look at my watch to see how many minutes it took me before I said the word documentation or a variation of it, because we're always talking about that. But really, documenting, communicating, following up on things, if we work on those skills day in, day out, that's going to be the best thing that we can do for our patients, for our practice, for the care we provide, for a good night's sleep, because, we are human beings and we are doing very extraordinary things. And when we're at the bedside delivering this care, no papers have been served. There are no attorneys involved. So all we want to do is make sure that we're keeping track of things, that we're making notes on it, that we're informing everybody who needs to be informed of what we're doing and closing those loops, and that we are making the best decisions that we can for our patients, given the information in front of us. Because when we are doing that and we're following standards of care and policies and best practices, those things will always be protected. Those things will always be defended. And the other thing, it sounds very cliche, but there really is no such thing as a stupid question. And with the services that we have, they're yours to employ, and we're always happy to be of services. So certainly in keeping up with the trifecta, I will always say we take tremendous care in healthcare when we get report to one another, right? Because we don't want to have to call someone up and have to ask the question because we didn't write it down. So we just have to take that same care and put that into writing the things that we did for the patient, because that is just as, if not more important, because that's going to protect me, Joyce, and the healthcare provider.
Exactly. Thank you, Joyce. Now, my last question is going to go to all of our risk management consultants, and this is one of my favorite questions to ask our guests. And we'll start with Deanna for this one. If you could share one piece of advice with all of our policyholders, what would it be?
Oh, it's tough. Just one piece. Well, I mentioned I worked as a nurse, and while I did get involved in the legal aspect, while I was still practicing and still doing bedside nursing, I really do think it made me more proactive in my care, in my documentation, as well as my communication, which we talked a lot about today as well. I do wish that I would have got more involved in different societies back at that time, like Army and Ashram, and while I was still doing the bedside nursing. And back then, the interaction with the risk management department on the actual units was very sporadic and usually very reactive. So again, talking more, with the risk managers, in the facilities. So I do recommend that for, a lot of new nurses, for the residents coming out of school. Don't be afraid to discuss certain things with your risk manager, and really, communication right now, in general is really looking very different, with advancing technology, with AI. And really, those providers, shouldn't lose the sight of those subtle things, that intuition, walking, into every patient room, every patient encounter, and just thinking about those top risks in the back of their minds, as they interact with patients, and as they interact with the families as well. As a healthcare provider, you're walking into a room, you're looking around at the IV line, what monitors they're on, who's with the patient, doing that overall assessment, but really keeping those risks in the back of the mind as well, I feel, is always helpful. And one of the things I like to tell, insureds, as well as, new nurses or those residents. And of course, I think someone mentioned, about the questions, not being hesitant to reach out for further clarification if something just doesn't feel right, and I always, I'm a mother of all boys, so I always said that's that spidey sense. If something doesn't feel right, just listen to it and act on it, so those are some of the things I, takeaway things and things that I like to share with insureds.
Great advice, Deanna. And intuition is there for a reason, right? If your spidey senses are up, you should question it.
Absolutely.
Mark, do you have one piece of advice you'd like to share with our policyholders?
I do. Maybe a little bit more than one, but I'll make it quick. We've talked about documentation, we've talked about communication, we've talked about follow-up. I think all of those things we have to do. But I think the other thing that I would really advise people to do is use our services here at MLMIC. Not to give a sales pitch, but it is. I mean, all of our offerings that we have here are included in your premiums. So there's no financial barrier. There's no reason to not reach out. And like one of my colleagues said, there is no stupid question. We're always here. There's always somebody available. We have our own culture of safety here, so it's non-punitive to call us, and I really can't stress that enough. And one other thing that I would also point out that Deanna pointed out is get involved, whether it's getting involved with us and working with us, or it's getting involved with your local medical societies, or national or state level societies. Very important to work with them and make sure that you're well informed of what's going on, not just with the societies, but in medicine, and also at the level of legislation.
Great advice, Mark. Thanks. Joyce, anything to add? Do you have one piece of advice that you could share?
I think, Tammie, that I'm just going to echo what Mark and Deanna said. I will say, in a past life, I had done organ and tissue donation. And the thing we always said was that we would always rather be called and not needed than needed and not called. So what Mark said, what Deanna said, what Shelly said, we are here, and it's our pleasure to be of service. And certainly, in building relationships and support, we all need to have that person. I will joke that I will always phone a friend if I need something, but really, we can be that sounding block. We can be that place just to run something by. And it is part and parcel of being with MLMIC, and we are happy to provide it. So we're always here, and it's really, truly better to be called and not needed than needed and not called.
Exactly. And also, as Mark pointed out, that we have so many risk management services, and they're available to all of our policyholders at no additional cost. So it's simple for you just to reach out to Joyce or Mark or Shelly or Deanna with questions or concerns, to schedule a educational program. We make it very easy for our policyholders. So why not take advantage of that, right? And lastly, Shelly, one piece of advice for our policyholders?
It's a double echo and, triple echo, actually. We've all been talking about it. Remember, we're here. We know that resources are limited. We also know that as new things come up, you're developing a program, you may not have developed an internal level of expertise. You know, Joyce goes in and doing a survey and puts, 2 promises on the table when she's there. My promise to everyone, when I'm there, when I'm on the phone, anybody that I'm dealing with is, we're an extension of your staff. There are no stupid questions. We've heard that over and over again. And calling us ahead of time gives yourself the advantage of additional information and to be able to put together a better widget. Maybe we have templates. Maybe we've seen a good model. Maybe we've experienced that good model. We all came from operations that in some way, shape, form, or fashion. So just to echo, either on the proactive side or sadly on the reactive side, if you need some advice on what the best ways to approach something is, remember our number. And, each one of us are individuals, but as you have heard, when you call for risk management services, whoever is, here, if your guy is out of the office that day or on vacation, just remember to call us because, we can be your guy.
Thanks, Shelly. So all good advice from our risk management consultants. And I just wanted to say, thank you to all of you for making time in your clearly busy schedule. We've heard all of your services and what you do on a daily basis and how all your responsibilities change depending on our insured's needs. So I'm really grateful that you all carved out some time to, share your stories with our policyholders, share a little bit more information about our services. And I'm really excited to celebrate you all, not during Healthcare Risk Managers Week, which is June 14th, but every single day of the year. And listeners, I will put information in the notes to this podcast, how you can reach out to our risk management department to either connect with your specific risk management consultant or ask a question or schedule an educational program or a survey. Thanks, guys. It was great to have you.
Thank you, Tammie.
Thank you, Tammie.
Thank you,
Thank you, Tammie.
And that's the verdict on MLMIC's risk management department. Policyholders can connect directly with the risk management consultants to schedule any of the services we discussed today. You can reach them by phone at 1-800-275-6564, where you'll always be greeted by a real person, or submit a question at any time at mlmic.com/contact. This podcast is for general purposes only and should not be construed as medical or legal advice. This podcast is not comprehensive and does not cover all possible factual circumstances. Because the facts applicable to your situation may vary, or the laws applicable in your jurisdiction may differ, please contact your attorney or other professional advisors for any questions related to legal, medical, dental, or professional obligations, the applicable state or federal laws, or other professional questions.